Hello, I'm Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences. Today, the UAMS Fay W. Bozeman College of Public Health released its latest projections of the effects of COVID-19 in Arkansas, just as they have done regularly for more than a year. These forecasts, like those released in the past, rely on data provided by the Arkansas Department of Health and on conditions remaining the same. Today's report underscores the fact that we are definitely deep in the middle of a fast-moving COVID-19 surge in Arkansas. The Delta variant is more virulent than the previous strains and is spreading quickly. Vaccination is our best defense against this virus, but unfortunately, Arkansas's rate of vaccination is one of the lowest in the country. The COVID-19 test positivity rate in our state is more than 20%. This is 5 times the national average. Although testing rates are low, this is a very high rate suggesting rapid community viral spread. Today's forecasts predict nearly 372,000 cumulative COVID-19 cases in Arkansas by July 26, an increase of 16,000 new cases when compared to what was reported by the Arkansas Department of Health on June 18th. In the next 15 days, the number is expected to increase by more than 1,000 cases per day. The model continues to show Arkansans between ages 35 and 59 with the highest number of COVID-19 diagnoses. New cases in that age group are forecast to increase in the next 15 days by nearly 6,000 cases and an average of almost 400 cases per day. Unfortunately, the model is also forecasting an increase of more than 2,500 cases in children under 17, or a daily average of 169 cases. The group with the greatest number of hospitalizations statewide will continue to be adults ages 60 to 74. However, the models suggest hospitalizations of adults 35 to 59 will soon exceed those of patients 60 to 74. Here at UAMS, we are seeing younger coronavirus patients with an average age of 40. Most are unvaccinated individuals who are healthy prior to their admission to the hospital. Instead of enjoying time with their family and loved ones this summer, they are in the hospital struggling to breathe and stay alive. If you aren't vaccinated, please get your shot and make sure your eligible children are vaccinated as well. If there are friends or family members of yours who refuse to get the vaccine, please talk with them and try to convince them to get the shot. This virus is spreading quickly. It's a runaway train, and the only way to slow it down is for more Arkansans to get vaccinated. Do it for yourself, do it for your children and other loved ones, and most importantly, do it before it's too late. Now, I invite Dr. Mark Williams, Dean of the Fay W. Bozeman College of Public Health, to explain the latest models in more detail.
Thank you, Chancellor Patterson. Hello, everyone, and thank you for joining me for the UAMS College of Public Health's July COVID-19 report. It's been a month since I last shared the college's report with you. What a difference a month makes, or even a week. Cases, hospitalizations, and deaths due to COVID-19 are increasing in Arkansas, and some hospital systems in the state are filled to capacity because of new COVID cases. I will return to this at the end of the slide presentation. As always, I'm beginning with the model forecasting COVID-19 cases in the next 15 days. The 15-day forecast for July 26 shows cases in Arkansas will reach 371,276 cases, or around 15,000 new cases between July 11th and July 26th. I also want to show you a 30-day forecast of new cases throughout the state through August 9th. You will notice the curve is showing the beginning of what we believe is a new exponential growth curve. The forecast shows Arkansas will have a cumulative caseload of just under 400,000 cases, adding about 36,000 new cases by early August. This slide shows the 15-day models for age groups in the state. The model is forecasting the greatest increase in cases will continue to be in adults 35 to 60. increasing by 5,591 cases by July 26th. This group has been the one most likely to have the highest number of infections for some time. The group with the second highest growth will be young adults, 18 to 34, as the orange line in the figure shows. The 15-day model is forecasting an increase of almost 5,000 new cases in this age group by July 26th. The third highest group, and the one we are very concerned about, is children 17 and under. This model is forecasting 2,538 new cases by July 26th. This map shows the relative change in COVID-19 cases in the last 2 weeks. During the last 2 weeks, for those counties for which a relative change rate could be calculated, 25 had increases over 100%. Compared to the map we presented in June, in the upper left-hand corner of the slide, there's a lot of red on the July map, meaning there's been a lot of change in the last 2 weeks. The figure on this slide shows the 15-day forecast for COVID-19 hospitalizations in the state for July 26th. The model forecasts 564 individuals will be newly hospitalized for COVID-19 between July 11 and July 26, an increase of 2% over the previous 2 weeks. The 30-day model, which I've not included on a slide, is showing the early beginnings of an exponential growth curve. Hospitalizations lag cases by 1 to 3 weeks, so this pattern may be indicative of a greater growth in the near future, particularly given the low rate of testing in the state. The 15-day model, using data through July 11th, is forecasting we will cross another milestone in COVID-19 related deaths. The state is forecast to have 6,043 cumulative deaths by July 26th. In other words, we should expect an increase of 40 deaths in the next 15 days, or an average of 3 deaths per day for the next 15 days. On this slide, the deep purple areas on the map are counties with 40% or more of their population above 12 years old who have been vaccinated. As you can see by comparing June's map in the upper left-hand corner to July's, there has not been much improvement. No county in the state increased its vaccinations by more than 5%. The low rate of vaccination in the state is having, and will continue to have, an effect on the number of people who become ill or hospitalized with COVID-19. As I have mentioned at the beginning of the slides, the COVID-19 pandemic in Arkansas has radically changed in the last 2 weeks. The models shown in this report were calculated using data from July 11th. The forecasts may already be out of date. We do not rely on data alone when constructing our forecasts. We also use research on the data and observations of how the pandemic is progressing in other countries around the world. Arkansas data and the science suggest the state is at the beginning of an exponential surge, which in the long term may exceed the December-January surge in terms of cases and hospitalizations. The population of the United Kingdom was far more vaccinated than the population in Arkansas. Nevertheless, the Delta variant caused a surge in all parts of the country, including the less populated areas such as Scotland and Wales. The character of the surge in the UK was also different, affecting young adults and children far more than older adults. Similar patterns are beginning to emerge in many countries around the world. Our considered opinion is, with low vaccination rates, few Arkansans practicing personal mitigation behaviors, and state policies which seem to discourage protective measures, Arkansas is at the precipice of a new surge in COVID-19 cases and hospitalization. Our considered opinion in the College of Public Health is Arkansas is entering a particularly dangerous time. The state's COVID-19 caseload will exceed 3,000 new daily infections, the high point of the December-January surge, within 2 months' time. If this should come to pass, hospitalizations in the state will severely challenge the capacity of the system to handle all patients needing care. Rather than older patients, the burden of COVID-19 will fall on younger adults and children throughout the state. You might recall we said in our June report, COVID-19 is not over in Arkansas. It is at best smoldering. Well, COVID-19 is no longer smoldering. It's broken out into a raging forest fire that will continue to grow in size and strength. Nevertheless, we cannot stand still. We must act to reduce the consequences of this new surge to the extent possible. Wear a mask in public places. Social distance when you can. Frequently wash your hands with soap and water. And most importantly, if you have not been vaccinated, get vaccinated. It's not too late. If you know someone who's not vaccinated, let them know you care enough about them to urge them to get vaccinated. See you again in 1 month on August 23rd. Until then, goodbye and be safe.